I will begin from very basics of repertory, and then slowly we'll learn the art of repertorization. So when I first came to hear about repertory, the first thing that I wanted to know is what is repertory basically. And then repertory basically is a list of symptoms with the group of remedies that cover that list of symptoms. And because our materia medica is such huge, has such huge data, it's impossible for us to remember so much of symptoms. So whenever we want to find something, we can find in the repertory. So in today's language, it is very similar to something like a Google, where again there is huge amount of data available on the internet around us, which we don't know and which we want to find. And whatever we want to find now, we always use Google today. So similarly, so for example, I would like to compare Google to repertory. So for example, if I'm searching today that what are the different restaurants that are available near me. So Google gives me this list of restaurants, and it also gives me ratings of those restaurants. See, it is 4.1, 4, 3.7. So similarly, what happens in repertory is that we ask the repertory to find a group of remedies which cover the whole symptom picture of the patient. So we see here that calcarea, sepia, phosphorus, cantharis, lycopodium, nux vomica cover all the symptoms. But similar to what Google does, there is gradation, there is rating given. Calcarea has higher rating even though it covers all the symptoms like sepia. Now this is where, it becomes slightly different. After we have the rating, even if we look at the restaurant, we don't just go to the restaurant with the highest rating. What we do is that we choose, we say, okay, Spice Stories has the highest rating, but it's expensive, or I am going with my friends, so I don't want that kind of food. I am going with my family, so I need some better restaurant. I need a bigger one. Okay, I don't like the taste. They don't serve Punjabi. I'm looking for Chinese today. So what we do from these list also, we individualize and we choose that one that suits our needs. That is very peculiar for what our need is today. Similarly, we have to do with these group of remedies after repertorization. We have to find the individualistic features out of this group of remedies to choose the exact remedy for the patient. So we have to look, what we have to look other than just the symptom that head pain, headache, bathing, washing aggravates, we have to also look at how did this patient narrate this symptom. Was the patient very, oh, it is feeling very too much, or doctor, I have head pain, or the patient was weeping along with this. How did the patient come? How did the patient interact with you? How did he make you feel during the interview? All this is what in homeopathy we call is the essence or the spirit in which these symptoms are being narrated. So we don't have to look only at the symptoms of the patient, but we have to also look at the narration of those symptoms, how these patient symptoms are narrated, what are these symptoms telling us. This two together should tell us which remedy to choose, not just this list of symptoms. If we start giving remedies just based on this list of symptoms, then we will not be able to give the patient the correct remedy, even though the remedy covers all the symptoms of the patient. It is important that the spirit and the essence also in which the patient is talking also matches. So the question is here that there are two kinds of repertorization. One is mechanical repertorization, where we have all these symptoms, and the other is artistic repertorization, where we also look at spirit and essence. And this is what we will try to learn today, how to basically choose rubrics where both these match up. The mechanical, that is what the symptom is, but also how the symptom is. How has the patient it? What is the symptom and how is it now? Both have to go hand in hand. If we do that, then that is the correct repertorization. Huh? So let us see how to do this from various case examples. So the first important learning for today is look for how and not just what the patient is narrating. So there are three methods. First, we have to analyze and evaluate the case very well. And then we have to learn to search that symptoms which we have reached from our analysis and evaluation. Then we have to also learn some special skills of how to convert, especially when it is related to the mind section. So let's start with the first thing, that is how to analyze and evaluate. So I will do all these three together with various case examples. So in analysis evaluation, we will first define what to search. Basically, we'll be using Kent's totality. So we will choose mental symptoms, physical generals, physical particulars. So this is the first case. The first case is of a patient who has HIV, who is HIV positive, and he is very, very ill. He has lost a lot of weight. And the initial narration that I get from the uh, people who referred me is they say that, doctor, this patient has HIV, but please don't ask one question. You know what? That where did you go? Did you go to a prostitute? All that questions, please don't ask. We are very confident that this patient has not done any such things. All doctors ask us the same thing. That this guy has HIV, so that is what they ask. And we tell them, no, maybe it could be due to blood transfusion, etc. So I was strictly told not to ask. Then when the patient came for the interview, when he was talking uh, or narrating his symptoms, he was not narrating. He would tell, okay, you tell. He would tell his wife, I will tell the symptoms later on. Okay. And I was by the confidence that his wife and the patient who was referring him had, that this patient has not had any such extra marital sexual interactions. So these were my initial observations. So then I asked, what are the symptoms? So this is what they tell me, that he has loose motion since, and every day he has around 10 to 15 loose motions, watery loose motions. He has lost 10 kilograms in the last 3 months. Huh? Then the patient tells me, I think I am developing cataract. In fact, just last 3 months back, I also got operated for cataract. And I am just 46 years old. I think I'm not even able to hear properly. My memory also is not functioning properly. Somehow I feel, I'm getting old very early. I'm, 46 years, who gets cataract? It's too early. I think I'm growing old. Everything, seems just getting deteriorated. This is how I feel. And then he also had herpes very recently. These were the symptoms. So now if we repertorize, what do I see? So if I can take symptoms like this: stool watery, because of stool, so much stools, patient is losing weight, so he's getting emaciated, he's losing his memory, he's losing his hearing, he's developed cataract, he's developed herpes, right? This I can take. But you know what? Like we learned, we don't have to take only the symptoms that the patient is telling, but we also have to take how these symptoms were narrated. So then I think, okay, I feel something is not right here. So I think to myself, what is missing? And then I understand, I think I don't have a really good individualistic characteristic symptom here. I want something individualizing. And then I felt, I have not considered HIV, its clinical understanding, etc. And is I don't know what is the generality here. What is the general feature? I have taken all symptoms as general. Emaciation is general symptom. Hearing loss, cataract, everything is general. It's not getting peculiarized. But I need to find a general symptom which is encompassing the cataract, the eyes, the diarrhea, everything. Do I understand that? If I understand that, then that is the spirit or the essence. If I understand that is the core. And this is what Boger or Kent or Boning Hussein has been telling us, or Fatak. All of them have been telling us that we need to look at the general first. And us different options like Boning Hussein generalization, Kent's partial generalization, pathological general, or like Dr. Gaurang was saying, he also called it one more name for it is pathophatak. Basically, Boger Fatak. Their work was in the pathological general. What is the generality? So because of that, then I asked myself, what is the clinical aspects here? So if you look at any HIV case, this is the normal progression. First, initial stages, early stages, patient has just non-specific infections. Chronic stage, patient has fatigue, diarrhea, weight loss, herpes, and realize, okay, this patient is in chronic stage, and all these symptoms are common symptoms of chronic stage of HIV. So if I find a remedy which has HIV, then all these symptoms are. So what is characteristic? What is individualistic to the patient, not individualistic to the disease? That is what we are looking at. And in last stages, then you find tuberculosis, leprosy, oral fungus, low hemoglobin, which is AIDS, which is known as AIDS. So I identify first in this case that kind of mind is in the chronic stages. So then I go ahead and then I look at the same symptoms again. So I realize loose motions, weakness and herpes, all these three symptoms are common symptoms of the disease. So what is peculiar here is hearing loss, memory loss, cataract, correct? So now another option, I can only take these three symptoms. I can say cataract, I can say hearing loss and memory loss as characteristic symptoms. But then once I identify that this is characteristic, I now look at how did this patient narrate? How did this patient talk about cataract or hearing loss? He said that, from all this, I feel that I'm getting old. I'm getting old prematurely. This is too early age. I'm deteriorating. So that is why my main symptom in this case was that early senility, premature senility. This I understood to be the general characteristic symptom of the patient. Right? So this we can call as partial generalization or Boger's pathological general or Bonning-Hussein's grand generalization. So this is the two rubrics from all these symptoms. Only two things to affect immunity. It has to have HIV. Second, it has to have premature and old senility. Now I search repertory. I find there is no such rubric in the repertory which says low immunity or HIV remedies which have HIV. So I don't find any rubric there. So the only rubric I take is old age premature, right? Now I start looking at the mental symptom, and this is what I observe that the patient, when he started narrating, he said, "Doctor, all this started, when one day suddenly my whole left arm started tingling, numbness I started having, and it was so much that I just fell down. So my office colleagues got scared and they took me to the hospital. And the doctor was asking me, what happened? What happened? What is happening to you? And I was like, no, nothing. I don't know. I don't know what is happening. Then the attendants used to come and ask me, what is happening? I used to say, yo, I don't know. That colleague of mine that has come from my office, you can ask him what is happening to me. And sorry, I was not understanding, doctor, what is happening. I was like completely, I was senseless. Even in office daily work, if some kind of pressure comes, no, that sir, this work now how to do, this is the problem. Then I get, I just don't know what to do. I say, no, you look, you only see what needs to be done. So that's how I am. Then the wife tells me an incident. She says, doctor, he like this only. What happened? Once we were going back to our house after seeing a late night movie. So there was nobody on the street. So he was driving the two-wheeler very fast. I and my daughter were sitting behind. He was driving the two-wheeler very fast. And then, suddenly a pig came in front. So he didn't see that it was nighttime. He just hit the pig, and we all fell down. I too fell down very badly, and I got my sacrum bone fractured. He just fell down there. He got a slight scratch. My daughter fell down. She was weeping, and I am telling you, doctor, that he just was lying down there like this. 5 minutes, and I'm thinking I'm not able to get up now. What to do? Nighttime, nobody on the street. Luckily, someone came after 5 minutes. They saw what has happened, and then they took us to the hospital. And even in the hospital, he was just like, and he was not telling any symptoms. He was not worried about me or my daughter. Just like that. That is how he is. And then he says, even while crossing the street, doctor, if I see someone that is coming near, I stop first and I say, oh, let him go first. Maybe I will get into a fight. Rather than that, I will just stay back. Huh? He is not even able to do daily routine duties like going to the bank, filling, doing cash deposit, booking a cab for the family, paying electricity bill. All this also I am not able to. Any stress, I say, okay, wife, you please look after. And then the wife tells me that he is very highly sexual, doctor. Very highly sexual. I am telling you, he's so sexual that every day during the night he needs at least 4 to 5 uh, sexual interactions. At least 4 to 5. And if it is a holiday, then night 4 to 5 and day 4 to 5. And I was going mad and I used to say, no, I don't want this. And after some time, I said, I am not having any kind of sexual contact with you. Just forget it. So then, I felt, how many days that you have not had? She says 1 year. I said, she had so much of desire. You are not having any sexual interactions, but still you are confident that he is not gone anywhere outside. What gives you this confidence? It was very strange for me. So then, so then she tells me that doctor, he's very, very shy. Even if any woman enters our house, he will go inside. He will not even look at a woman. He's always looking down. He avoids any kind of woman contacts. He has never talked to a woman. I have not seen that. So that is why we are very confident of that he is completely incapable of doing any such thing. Right? So from all this, one thing that we can always do is that, where am I? Okay. From all this, one thing that we can do is we can take symptoms like this, that the patient becomes senseless, dull, not able to narrate his symptoms. The patient lacks confidence whenever he's encountered. He gets scared easily even while crossing the street. His mind is very dull. He does not react to the situation. Wife is getting hurt, family is getting hurt, but he's dull, just lying there, right? He's He's cowardly also. Any kind of interaction he does not want to do. He's incapable, and lot of sexuality, right? This can be one way of doing it. But then, like we did in the physicals, what we have to see is, from all these symptoms, what is the common thread that connects all these symptoms together? Why is the patient dull? Why is the patient not having confidence? Why is the patient cowardly? Why is the patient sexual? If we ask this question, why, then we will get to the root symptom, which in homeopathy we can call as generalization, or the spirit, or the soul, or the essence, or the sensation, whatever. All stalwarts basically are teaching us the same thing, that is to look for the general beneath all these symptoms. That we have to do. So how to do this? How do I now sum up all these symptoms and find those and first define what is the rubric that I really need to find in this patient? What is that? Uh, I keep going back. Okay, right. So then, uh, so yeah, this is what was missing. We need to find the underlying thing, the general, and that is what all stalwarts, Sankaran, Vithalkos, Segal, all of them are teaching us. Look at the symptom beneath all these symptoms. So then I look again and I observe what is the thing that is coming up repeatedly in each of these symptoms. So then I see. So firstly, in the office, when it started, his thing is, give up. I don't know. I am not understanding. He says, I am not understanding. I am senseless. In office, anybody asks him any difficulty, I am not understanding. I don't know. I don't know what to do. Huh? I meet the accident. I don't know what to do. I don't know how to react. I am not even able to pay bill. I am not even able to what you say book a cab. So even basic things I am completely incapable. My mind is very stupid, dull, not capable of doing anything. That is what is coming up repeatedly from all these incidences, that I am incapable. I cannot do anything. So if somebody is encountering, no, you look after. Somebody is trying to come at me, no, I am incapable. You do, you go first. I am not there. So his mind is very dull, very stupid or imbecile. The rubric for this is imbecility. Imbecile means your mind is like dull, stupid, not able to function, not able to react to situations. This is one generality I find. So I don't take confidence, lack of, cowardice, etc. My main symptom here is imbecility, imbecile. If you can give him that sharpness of mind, he will start doing everything. And then I observe that sexuality I'm not able to understand. How does imbecility and sexuality go in? So I keep sexuality as a separative symptom, but it's a very strong symptom. Too much sexuality. Also, it is connecting with the pathology of the patient. His pathology is something that is related to sexual disease. So that is why sexuality is my second generality. Very intense symptom, also connecting with the physical symptom. So this is second symptom in the mind. Sexuality and imbecility. Memory weak is also part of imbecility. So from this, then I choose the following rubrics together with physical and mental symptoms. Old age, premature, imbecility, sexual desire increased in males. One of the rubric is male sexual desire, masturbation, disposition to irresistible. At every small chance he wants to have a sexual intercourse. And the remedy that comes up is bufo, buforana. And then when I read Buforana from Boric, the first thing that Boric writes is it affects lymph nodes. Basically, in HIV, our immune system is affected, and especially the chronic immune system. And the main storage of our immune system, of our chronic immune system, is in the lymph nodes. So that is where the one of the rubric that was left in the physical, that is immunity, gets covered when I read the materia medica. So I don't find that in the repertory, but I get it in the materia medica. Then you see Boric writes prematurely senile, imbecile, huh? Used for feeble-minded children, more or less connected to derangements of sexual sphere. So I gave this patient Buforana. And when he came to me, his CD4 levels were very low in spite of taking allopathic medicines. He was taking them for 3-4 months, but nothing was helping him. He was keeping on having these loose motions. He was keeping on having all these infections. His CD4 count was very low. It was 124. It should be around 400 minimum. The main guideline in AIDS is CD4 counts. So then you see slowly the CD4 count started to rise after homeopathic medicines from 124 to 195 to 201. Now, what is also important is since the remedy for 3 months, he did not have one loose motion, no infection, everything completely stopped, no infections at all. Huh? Then he tells me, I got my confidence back. I started to drive. You know, doctor, first time I drove the vehicle and I saw someone was crossing the street. And I said, no, I'm not going to be scared. I'm going to go my way. I'm not going to stop my vehicle so much distance. Let him go, then I will go. My confidence has come back. Most important thing is his wife tells me for the first time ever in his life, he took up a responsibility. You know, I was going through a bad time. I was weeping because my daughter was not listening to us for certain things. And I was weeping and I was in a different city with my daughter at her hostel. So he said, don't worry, I will come. He came from our hometown to meet us, both of us, and he tried to make us understand that no problem. I will help all of you. We will solve this problem. And she was so happy. Never in my life has this happened. First time in my life, this has happened. So you see, when we take rubrics like this, there is transformation of a person, not only on physical level, but also on mental level. His whole mindset, his whole behavior, his whole symptomatology, his whole pathology, everything starts to improve. And this will happen only when we are taking symptoms which are not only the mechanical symptoms of the patient, but also the artistic part. If we can combine both these together, along with pathology, along with uh, toxicology, everything, that's it. That's how we need to repertoire. That's how we need to convert patient's language into rubric language. So let me give you some more examples of how to do this, right? So now I will not be going so much into the details of uh, how to analyze and evaluate. I will directly be telling you symptoms of how to search and how to convert patient language. So let me give you one more example. So this is a case of hyperthyroidism, right? And this patient had very severe hair fall, and she was a female of around 16 years old. She had severe hair fall, the most severe that I have seen. So she says that she had hair almost till her sacrum when she was 14 years old. Suddenly something happened and she started losing hair. And when she met me, she had so little hair that she couldn't even tie a pony at her. It was so little and she was very concerned that she is going to go bald. She had tried many treatments. She had tried Ayurveda, she had tried allopathy, and then as a last resort, she had come to homeopathy because it was found out that all this was because of her thyroid levels being very high, and she was put on steroids, and they said after 4 5 months we may you will enter into hypothyroidism, and then we will put you on Elmoxin. And this, the parents got scared, and that is when they came for homeopathy. So her complaints were she had throat affections, and her main thing all this, how it started 2 years back was she had a lot of stress in the exam. And she said that one is I find a lot of difficulty to study, to read and to remember what I have studied. Now, studying was a big difficulty for her. And in spite of studying so much, and after a lot of work, I used to memorize things. But you know what used to happen is when I was writing the exam, I would get jumbled up very easily. So like for example, if if there are three questions, I know the answer for all the three questions, but I would write the answer of question number one and write of question number three in question number two, writing it in the right place. I used to not remember the first sentence. Directly I would remember the second sentence in the answer or the fourth sentence. So I would first write the third sentence, then the fourth sentence, then the first sentence. Everything used to just get disconnected. I used to feel, why does this not come to my mind in a very systematic flow? Why does this all these separate sentences not get connected in one single form? I'm not able to remember it in one particular form. That is my problem. And because of that, I make silly mistakes and I lose marks. This causes a lot of anxiety. So I thought it is because of my underweight or strength, etc. So I started taking tonics, I started taking milk, I started doing all kinds of things so that I will gain weight. But instead of gaining weight, I started losing weight, I started losing hair, I started losing everything, I started having throat infections. All this I started to have. So now what I understood in this case is that the main thing in this case is what? Her difficulty to study and her difficulty to perform in the exam. So now how do I take? Now how do I take this symptom that cannot connect sentences or make silly mistakes during exam or nervous during exam? So initially I didn't understand what to do. So I gave remedies like gelsemium, urgentum, etc. Exam anxiety remedies. But I knew I need to find the remedy which has this jumbling up, no connection, going like this, finding it difficult to study. So what I did is I said, okay, from all this, one word that I can definitely find is in repertory is all remedies which have difficulty to study, right? And there is no such one rubric also in any repertory: studying difficult, not able to study, inability to study. There's no such rubric. So what I do in such cases is that I use the search function in Mac repertory. So there's a search function where if you open the search functions, you see this window, and here in the word section, you type the word here. So I typed here study and I said search all repertories and all rubrics from the whole list of repertories that Mac repertory has, which have the word study in it. So I search for all such rubrics and I get a whole list of symptoms. So there are around 299 such rubrics. So from what I do generally, then I keep reading each of these rubrics and see which one suits my patient, which one gives me this kind of feeling that, this is what my patient is telling. So I try to search from this. I keep reading. This is how I search them. This is how I convert it into rubric language. When you don't know, see, I don't know what rubric, so you have to search in the repertory, then you will understand. So in this case, I find this rubric, study inability to, and which is given in Nair's repertory, and there are 7 remedies in it: calcarea, china sulphs, sumbul, melilotus, abyss nigra, gymnocladus, viburnum. Now out of all this, I read all of them, and then one remedy out of this is gymnocladus. And when you read gymnocladus, this is what you get, that it has throat affections. You remember our patient has throat affections, throat infections. She also has thyroid affections, which is also related to the throat area or located in the throat area. Then there is headache in this remedy. Most important thing, she cannot think, cannot comprehend or study, forgets everything. Then I search from the repertory and then I look at that which family does Dimnocladus belong to, and I understand that it belongs to Leguminosae family. And we all know Leguminosae family, the main sensation is scattered, not being in one continuous unity. So all symptoms are scattered here and there. Like that, all my thoughts, all my things that I memorized are scattered there. I cannot form them into one continuous unit, one uniform unit. This I understood. So like this, like I learned in the previous webinars, like this, we need to integrate everything. We need to use materia medica, sometimes notes, sometimes sensation, sometimes repertory. All this we need to integrate to find the remedy. So I gave gymnast to this patient. So this was her report when we started treatment. Her T3 was 2.7, which should be below 2.2. Her T4 was 14.85, which should be below 11. After the treatment, her T3 and T4 both came back to normal, 3.8 and 0.81. Now, the most important thing is, firstly, her hair was in 2 months time completely overlawn, after which her hair grew back and she now still comes to me. It's all hers. She has not hypothyroidism. Generally, they say such patients enter into hypothyroidism. No altroxin started, nothing, no other remedy. She's exclusively on. I stopped all her treatment a year back. She comes to me very rarely nowadays, just for a follow-up. They say that for thyroid you need to take lifelong medicine, so I need to check. So that's how this patient improved, and it's more than 2-3 years now, and she's completely all right. So let me show you another case. So this is a case of paralysis. So this is an old patient of mine. She has paralysis of her whole left hand side. She's paralyzed. She's in the hospital, and her main concern is that she's on she's on oxygen. And the moment they remove oxygen, within 2 minutes, her oxygen level in the blood drops from 90 to 60 in 2 minutes. So if you remove that for 5 minutes, she's gone. She's dead. So she was admitted like this for 1 month. She's not able to recover. So the hospital is telling the family that that she's too old now, weighing too much, and you're just occupying the bed. Please discharge. You can take your patient home. We will not help you. That is when the family, they say, can you help us please, our mother, she'll die, please come and do something. So that is when I went. And this is an old patient of mine, and she was coming to me for heart problems, and she had fluctuating blood pressure. She had atrial arrhythmias, and she had osteoarthritis, right? So I went to the hospital. I met the houseman there, and I asked him what is going on. What do all the specialists say? Why is she having this stroke? Yeah. So they tell me, everybody says that the stroke is not because of something that went wrong in the brain. The stroke is something that has to do with circulation. So I said, what happened to circulation? So they said they saw something in the report. I said, I want to see that report. I saw that report. And then in that report, it was written that the patient has cerebral stenosis. Cerebral stenosis means there is degeneration of the arteries. Okay, it is a old age degeneration, atherosclerosis of the artery. That is what cerebral stenosis means. Atherosclerosis of those arteries is taking place. I read that and suddenly it clicked to me, this patient's another symptom was she has osteoarthritis, which is also degeneration of the knee joints. So then I understood the main thing that this patient has to have is degeneration. So then I felt, which which remedies have degeneration. This is the general symptom of the patient. Degeneration has to be there in this patient. So like I did in the previous case, I searched the repertory, I put those words and I told, show me all the remedies, all the rubrics from all the repertories which have the word degeneration in it. And I find this from Clark's dictionary, which says clinical fatty degeneration. There are only two remedies, phosphorus and vanadium. And then when you read vanadium from boric, this is what you see. This remedy is indicated in heart's action. See the main principal affection in this that everybody was saying is, even though it is paralysis, the heart is affected. Where there is fatty degeneration of liver, heart and arterial walls, cerebral stenosis, atherosclerosis. Now this is very interesting. Then it says its action is as a oxygen carrier. This is exactly what the patient was going through. His her oxygen would drop immediately as soon as you remove it, and it acts as a catalyzer. It increases amount of hemoglobin. Another important symptom that I forgot to mention was the patient's hemoglobin was dropping daily. In fact, when I met her, it was around 8. When she got admitted, it was around 12. So it increases the hemoglobin. So you see, once you know the general and somehow find a way to search in the repertory how to basically find remedies which affect degeneration, and then you find the remedy which has the characteristic symptoms also. This is how we have to repertorize. First, generalize. Choose what is the general symptom. Find it, search it somehow in the repertory. And then you will find the characteristic symptoms also fit in. So this patient after vanadium 200 for BD for I gave her almost for 1 month, but within 1 week to 10 days, her oxygen mask was removed. She got discharged. She came home. She lived well for 2 months. After 2 months, she expired. See, you have to understand this was a very advanced case. So my role was mainly palliation, right? So I have another 15 minutes. Okay. So this is what or how you have to repertorize. I hope you're getting the hang of it. First, you have to enumerate the symptom. From all these symptoms, what is the general? What is the underlying pattern? That we have to identify with all means. This can also be a simple rubric. Patient has headache, patient has stomach ache, patient has knee joint pain. But all these three are ameliorated by heat. That is also general. In general, patient is ameliorated by heat. That is a general symptom. This is more simpler repertorization, which I felt all of us knew. That is why I am not focused on such kind of cases. But all that obviously we have to use. Now, the next case that I want to share with you is very, very interesting. So this patient, he came to me and he said, Doctor, I have lot of coryza. I constantly feel that something is going to flow from my nose, and I keep doing like this. But actually my nose is very dry, and I have this coryza since the last 6 months. I feel I have cold, but actually my nose is dry. I feel blocked. And I tell you, doctor, all this happened. You know how this happened? Because one day I was climbing the stairs at my house, and I was climbing the stairs very fast. And while I was climbing the stairs very fast, suddenly the lights went off. But still I continued. And because I couldn't see anything, I went and banged my head on the wall. And I banged it very hard. It was very, very painful to me. And it was so painful that since then I've lost sleep. I don't get sleep properly. I've lost my sleep. And I have been losing this sleep, slowly this cold and coryza started. Now in this case, there is only one symptom. No. And this patient has no other symptoms. He has no mental stress, tensions, nothing, he says. So in such cases, we cannot say, no, I have to find the general. In such cases, our repertorization has to be such where it has to connect to two things. We have rubric like ailment, events, head injury, or patient has coryza with dryness, or patient has sleep loss of sleep. Okay, if we take these three symptoms separately, then it will be a clinical repertoire. We will not stop there. We will have lots of remedy. What we have to do in such scenarios is we have to connect sleeplessness after injuries, or dry coryza with sleeplessness, or head injury with coryza. So you have to connect two or these three symptoms together and find a rubric which has both these elements, at least two of these elements. So in that word search that I showed you, in such cases, I put two words, sleep and injury, or coryza and injury, or various permutation combinations. And I see whether two things come together. If I find two things come together, then I pick that up. So in this case, this is what came up, that sleeplessness with injuries, after injuries. And then when I look at these 5 remedies, I understand the remedy for this patient is sticta pulmonale. Because if you read sticta pulmonale, it has coryza, but with dryness of nose. Patient feels there is lot of dryness, too much dryness in the nose. That is sticta pulmonale. So I gave this patient sticta pulmonale. After which, some more rubrics that I found are generalities, injuries, fractures, sleeplessness. With sleeplessness, single remedy sticta from Nair's repertory. So after I gave this patient sticta pulmonale, there was no cold, no coryza. Immediately after the first dose itself, the patient's coryza disappeared. He never came to meet me. I called him after a month. You have not come for a follow-up. Did you feel better? He said the day I took, all my complaints have reduced. I have no uh, symptoms at all. Hmm? So what I want to tell you from this case is, when you don't have 2, 3, 4, 5 symptoms, when you see that there is only one symptom, that one presenting symptom in the patient, that is the time we have to see how can I form a complete symptom out of this one symptom. How much ever you make permutation combinations, find rubric which is connecting 2 or 3 of these aspects. Try to make it as complete as possible. Location, sensation, modality, concomitant, cause, ODP, can all these come together? If all these can come together, that is what we also call in homeopathy as keynote prescribing. So if we don't find general, then use repertory to finding keynotes by trying to find form complete symptoms. So one last thing I want to tell you is this, that one patient of mine, he came and he said that this I want to tell especially with relation to mind rubrics. So one patient of mine, he came and he said, doctor, one of my main symptoms, what, I get angry very easily. Someone is trying to explain me something and trying to tell me, no, this is not how we should do it. That is how we should do it. All that someone is trying to tell me. But while they are trying to tell me this, I will in between tell, no, I don't want to listen to this. How can you say this? I'm not going to listen to you, etc. This I do with my parents, this I do with my wife, this I do even with my boss. And so they think that this guy is very impulsive, this guy is very rude, he does not listen to people, this guy is very obstinate, this guy is very angry, this guy is impulsive, irritable, or he does not like any kind of contradiction. All these people think about me. So now one way is we can take all these rubrics itself to repertoire, that rudeness, impulsive, angry disposition, contradiction cannot tolerate. All these symptoms we can take. But if you understand mind rubrics, if you understand the meanings of rubrics, then you will know that there is a rubric in the repertory which means abrupt. Abrupt means when I am talking to you, when we are having a conversation, when there is something that is going on, and then in between you just cut the conversation, you just end the conversation so that you look rude, so that you look like impulsive. That is what abrupt is. Now, abrupt encompasses all this: anger, impulsive, rude, contradiction. All this come together in abrupt. If you understand this one rubric, you understand the whole symptomatology of the patient. And this you will understand only if you know the meanings of each of the rubrics in the mind section, which is what Dr. Sehgal started and has done lot of work, and many of us may be following it, many of us may be aware with it, but I am doing something similar, and I actually, you can find all these rubrics that I am currently doing on the YouTube channel of the other song, where I'm daily uploading one rubric and explaining the meaning and how that one rubric encompasses so many other symptoms. This is very, very important to learn, especially if we are learning mind, or if we are using mind rubrics. This is very important for us to know how to convert patient language into rubric. So we would like to do many more sessions. I really would like your feedbacks on this. And those of you who, if you had any technical difficulties, you can watch the video on Hope, which will, the recorded session of this webinar will be available on Hope very soon. And I also, as Dr. Pankil told you, that I specialize in cancer. I have done one or two webinars, and I've done a cancer seminar which is also available on Hope. All of you can really go to Hope website and watch these videos. I really expressed myself completely on how to treat cancer cases, how you should approach everything. Hope you will like that too, and I hope you have learned something today from this webinar. Thank you. Dr. Pankil, please take over.
Dr. Shrikant, really it was a really informative and wonderful session, especially the gymnocladus and some news. So that I think that's the take home message, that we need not be very much prejudiced about specifics, but with an open mind try to arrive. So like it's matching two things. One, what to pick up from a case and where to look for in our Medica and repertory. Very well explained with wonderful cases. Just few queries which I was going through in the chat box. What was the frequency of repetition and potency in that case, in that particular case?
Which case? Gymnocladus?
Gymnocladus one.
200. I gave the patient 200 BD for 2 days, and she needed 2 or gymnocladus for 2 days.
Okay, okay, fine. That sum ups, and also the same in the case of Bufo.
Before, because the mental symptoms also were very clear, I gave 1M, and I gave 1M BD for 2 days, and then later on I gave him lower potency, that is 30, 200 repeatedly, because see, that was a pathological case. In pathological case, I generally don't see the ability to recover. In pathological cases, you may start high and slowly I come lower, 200, 30. And why all this I have explained in the cancer webinar if you go through that, and I give all that repeatedly. So later on I gave him 30 repeated BD for 10 days, 15 days, especially later on he had some infections also, especially during the infections I gave the such repetition.
Good. And there was one more query which says, why did you rule out phosphorus in that case when fatty degeneration is also one of the keynote for phosphorus?
I read both the remedies, but very clearly you can see vanadium matches other symptoms, no? The oxygen and the low hemoglobin. Phosphorus does not cover that oxygen. That was her main symptom, no? The moment you remove oxygen, the PO2 drops. She would have died immediately. That's why. Phosphorus does not have that symptom.
Wonderful. That sums it all.
Yeah. Any other?
Yeah. Any other queries from the participants? Okay, why was sulfur given after gymnocladus and what was the potency for sticta?
Sticta again 200. And what was the first question?
The first one was the indication of sulfur.
Okay. So after her reports came back to normal, her hair fall was not reducing. So then I took a totality for the hair fall, and her main symptoms were um, aggravation after bathing, or the hair fall used to increase after bathing, and also there was a sensitivity on the scalp where she did not
Hmm.
want to touch. So that rubric is covered by sulfur, so
Huh.
scalp with hair fall. So that is why I chose sulfur. After sulfur, her hair actually grew back. It did not grow back with gymnocladus. Good you asked that question. I didn't have time to explain all details. That's why I skipped that.
Okay. And there was one last query which we can take now. If you can, since you are doing a lot of the repertory work, can you please help us explaining a difference between imbecility and idiocy?
Imbecility and
Idiocy.
idiocy. Imbecility is more, not able to understand anything.
Hmm.
Idiocy also is like that, but the idiocy mainly, the only difference is in the facial expression. Idiocy is seen on the face.
Hmm.
No, that's the only
Yeah.
thing. Actually, in the mental, there is not much difference. Idiocy is demonstrated. It's just right in the face. No,
Hmm.
that's the difference.
Great. And if you can give some good line, good, like a startup thing for a beginners, how to use, how to learn clinical rubrics.